All right, so now for the GIRP. So the GIRP acronym, as I said, stands for Goals, Interventions, Response, and Plan. So it's framed a little bit differently, and everybody writes their notes in a different fashion. But I tend to prefer the GIRP model. That's how I was trained. I've tried both. GIRP just feels more natural to me. Now, the goal, right? This is the thing that you are trying to address in the short term in the session, but it can also be an overarching complaint. So if on your treatment plan, for example, the complaint was anxiety, you do want to put that into the goal, right, to address anxiety. But what do you plan to address in that specific session, right? And so that's where the goal would be to work on interpersonal effectiveness skills or something more specific like boundary setting. And so that would be reflected then in your intervention. Okay, and so then the intervention would, and obviously cover the basics. And so this is really what the clinician is doing to affect change. So first things first, in the intervention, we want to include things like assessing for risk factors, recent stressors, and exploring client coping behaviors. So if these are the stressors, how have they been coping? And of course, engaging the client and planning for more effective coping. So that's almost always going to be found under the intervention, but then you can tack on things that you're addressing specifically in that session. For example, if your goal for the session was to work on boundary setting, then you could say things like writer or clinician engaged client in learning skills for boundary setting to improve quality of relationships, or even more specific, process with client, recent event with sister, and how to avoid future arguments or verbal outbursts in response to being accused of something. But it's okay to be a little specific like that, because now we're addressing specific behaviors and problems causing the client distress. And this is also what's known as the impairment. So whenever we're documenting interventions, we're really wanting to make sure that we're speaking to the impairment, especially as far as insurance is concerned. Because if you've ever been to a documentation training, they'll tell you the insurance is, especially with audits, are primarily concerned about and are paying for the intervention, not the response. They're paying for the intervention and the plan, right? And so that's really where you want to be able to kind of just list a couple things about the particular problems that you're trying to address and how you're going about addressing them. Okay, so now for the R in the GIRP. The R in the GIRP stands for response. So the response is now what we saw in the SOAP model, which was the subjective, right? It's kind of that piece. It's just reversed a little bit in the GIRP. In the GIRP, the response comes after the intervention, and that speaks more to how did the client not just respond to your intervention, but this also captures that objective piece we see in the SOAP model. So it kind of lumps those two together. And the response would be things like client presented with, as oriented times 4, as well groomed, with normal speech, linear thought process, and stated mood as anxious, right? And then you would say client discussed, A, B, C, D, E, or 1, 2, 3, 4. Or you could say client responded well to intervention, communicating understanding of boundary skills, and committed to implementing skill, yada yada, with sister, as opposed to verbal outbursts. And so in the response, you're trying to paint a picture about how much clarity or how much insight the client has into the objective you're trying to achieve, or the things you discuss in session. And of course, in the response, you want to be able to touch on things like risk factors, right? So if the client, as you're assessing for risks, what does the client respond to that? Does the client deny any risk issues, risk behaviors, suicidal ideation, homicidal ideation, substance use, psychotic symptoms, or do they endorse things? How do they respond? Or are they not even able to engage with some of your interventions? Do they respond to redirection? Those are the things you want to kind of outline. And so I often will toggle between doing like a bullet point fashion for the response, or sometimes I'll do it in paragraph form. And either is okay as long as you're capturing kind of what's going on there.